So I just checked my patient's electronic medical record for any new labs or new orders, and she is post-op day 2 of an appendectomy. First I would check her door and make sure she doesn't have any contact precautions or any fall risks or flags like that, and she's good, so I'll knock. Hi Sarah.
Hi.
I'm going to be your nurse today. My name's Kelly.
Hi, Kelly.
So first, can you say your name and date of birth for me, please?
Sarah Hagelin, 3899.
Perfect. So right away, I noticed that she is alert and answering my questions good. So there's no like automatic thing that I need to do right away. So I'm gonna ask. So you had your appendix taken out. How are you feeling?
You know, I'm actually feeling pretty good. There's just a little tenderness by my incision site.
Okay, so you have a little pain, which is normal. When, or how much would you say, maybe on a scale of 0, with 0 to 10, with 0 being the worst and 10 being the, or 0, sorry, 0 being the least amount of pain and 10 being the most, what would you rate it?
I'd probably rate it a 5 out of 10.
Okay, and would you say it's a sharp or dull pain?
I would say it's kind of a sharp pain. Like when I'm sitting up, like it kind of like is sharp and then it's kind of relieved once I'm sitting up a little bit, but it definitely feels the best when I'm laying down.
Okay, so you'd say your relieving factors would be when you lay down, it radiates to the right of you.
Yes.
And all that. Okay, so I'm going to go into your general appearance. Your skin color is pink. Like I said, you're alert. You have a good speech quality, and she's hearing everything I'm saying. And she looks good and comfortable. And I guess I can just move right on into vitals. I will just keep noting her general appearance as I go forward. Well, actually, I like to do this first. So first I'm gonna do this. 4, 4, 'So her pupils constrict direct and consensually. Sarah, where would you say, or could you say my name for me and then where you are and what time it is?
So your name is Kelly. I'm in the health assessment hospital and I would say it's about afternoon right now.
Okay, so she's alert, to time and place. Her level of consciousness is alert, she's in good body position, and she, I'm just reiterating everything so make sure I didn't miss anything on general, but I know that she's alert, she's comfortable, she looks relaxed, and her pupils are constricting direct and consensually, so I'm just going to keep moving on with the neurological. Can you sit up on the edge of the bed, please? Okay, so I know no facial droop or ptosis. I'm going to check her ability to swallow. So she's able to swallow. Can you grab my hands and squeeze? Okay, now put your arms like this and pull towards you and push away. Can you put your legs or feet up? Push down. Can you wiggle your fingers and toes? Can you lift this leg up and this leg up? Are you experiencing any numbness or tingling?
No.
No? Okay. So I rate her a 15 on Glasgow Coma Scale. I was never concerned about her risk for like being in a coma or anything like that, but that's just something I'm going to keep thinking about her. She's responding to my touch, she's talking, she can hear me, and she's able to move, and she's opening her eyes. So her neurological system looks good, and I'm going to move on to her vitals. So first I want to listen to her heart. And I'm just going to look in the mid-clavicular line, 5th intercostal space, at the apex. So Sarah's pulse is a 92 and her respirations were a 16, so that is good. Actually, so now I'm going to test her pulse oximetry. Put it on her finger here. Here, let's try a different finger. I'll warm it up, make sure. There it goes. So her oxygen's a 97 and her pulse is a 90. So I was right. I'm gonna check her temperature. I'm gonna pull the pin up and back and insert it right now. She's at a 99, which is a good temperature. Now I'm gonna go to blood pressure. Sarah, what's normal blood pressure for you?
I would say probably like 115 over 74 probably.
Okay. So I'm gonna kind of check for her brachial pulse. I'm just gonna try and and I'm gonna estimate her systolic. So I heard it at a 118, so I'll pump it up to probably 130. Just do this. So it's a 116 over 78. Sure. So I'm going to move on to our respiratory system. First, I'm going to ask you a couple questions.
Okay.
Have you had a cough lately?
No.
No, okay. And so no mucus?
No mucus.
Okay. And you were given your intensive spirometer after your surgery. Have you been using it?
I actually have been, yes.
Perfect, because it's good to cough and deep breathe every hour, almost 10 times an hour to really expand your lungs. Okay, so I'm going to just listen to 6 spots on your posterior, or anterior, and then 8 on your posterior, and then on your side, okay?
Okay.
So I'm going to have you breathe in and out very deep. Just lift this up here. I'm going to look at your side here. Can you lift this up for me, please? Thank you. Deep breath. Deep breath. Okay, deep breath. Deep breath. Okay, now I'm going to look at your posterior now. Listen to it. Deep breath. So her lung sounds were equal bilaterally. There were no adventitious sounds or wheezing or crackling or anything like that. I would check her nasal cannula if she was wearing one, and I'd check the flow rate and her skin integrity around the nasal cannula. Now I'm going to listen to your heart. First, your aortic, your pulmonic, herbs, tricuspid, and mitral, okay? So just relax. I'm going to repeat with the bell. Oopsies, sorry. So I heard S2 best at the base and S1 best at the apex. Her apical rhythm is regular. There were no murmurs or split S1s or S2s. I'm going to check for any edema in her lower extremities, and I don't see any. I'm going to assess her pulses now. Move that up there. Start with the radial. 2 plus. 2 plus. 2 plus. 2 plus. Then last is dorsalis pedis. 2 plus. And 2 plus. So while I'm down here, I'm going to check her capillary refill, and she's wearing nail polish right now, but she had nothing wrong with her feet. She doesn't have any history of congestive heart failure or any circulatory problems, so I'm not too concerned, but if I had to, I would take the nail polish off. But I can always check her fingers. And they came back with less than 3 seconds. If Sarah had an IV, I would check the flow rate, of course the site, but for a circulatory system, I'm worried about the flow rate and that it's appropriate for her. And so now I can move on to your abdominal. I will actually have you lay back. Here we go. So first I'm going to look, and she has a flat contour. I'm going to listen in all quadrants. For bowel sounds. So I heard bowel sounds in all 4 quadrants. They were normal active. I'm going to palpate for any tenderness, being careful around her incision. I note no distension or guarding or firmness. Is it tender anywhere else besides your incision?
No.
Okay. If she had any JP drains or anything like that coming from her abdomen, I would check those and make sure that they were hooked up and running correctly and that the drainage was good. So I'm going to ask you a few questions. When was your last bowel movement?
This morning.
Okay, what was it like?
It was brown. I would say pretty normal, a good regular amount.
Normal, okay. So you didn't have to strain
No.
to get it out? Okay. And are you nauseous?
No.
No? And you're able to tolerate your current diet?
Mhm.
Okay, so that's good. I'll move on to her skin and make sure she doesn't have any lesions. So I see that there are no lesions. I see that, well, first of all, she normally, if you have surgery, you're going to have foot pumps to constrict your veins to make sure they're working correctly and everything, because you're probably not very active. So I'd make sure her foot pumps were on and turned on and intact. If she had any SED or TED hose, I'd make sure that those were on. Anything else with the skin would be, I'm going to pinch under here, check, and it comes back regular. I will check the warmth, make sure they're normal bilaterally for circulatory problems, so that's good. I would assess her for a skin breakdown using the Braden scale. She is not at risk because she doesn't have any excessive moisture. She's active. She has adequate nutrition. She's not really involved in any friction or shear, so that's good. If she had a specialized air bed, or anything like that, like maybe a water bed or something, I would make sure that that is working properly, because that's very important for her skin. So her genital urinary system, I would start just by making sure her hygiene is good. So that is probably something I would first note when I came in the room, but it is especially important for your urinaries and your peri area. Make sure that's all clean. She's clean, and I have noted no odor this entire time, so that's good. When was your last void?
About an hour ago.
Okay, that's good. And did it burn
No.
when you peed? Okay. And what color was it?
It was a normal yellow color.
Okay, and it was a normal amount?
Yes.
Okay, so if I noted any distension or maybe any retention with her urine, I would use a bladder scan and check for that. And so her skin, I checked. I think that's good. Her activity level, the biggest thing is a fall risk, and I would assess by looking at her history, her meds, her kind of what if she's on like benzodiazepines or anything like that, and she's good there. Have you been able to get up
Yes.
and walk around using no mobility aids?
Yep. No.
And you're able to kind of walk without and turn without too much pain?
Yes.
Okay, that's good. If she was in bed rest, I would make sure to initiate a turning schedule if needed. She isn't, and she's able to turn herself, so I'm not worried about that. But if that was a problem, I'd make sure that was very important. And I would make sure the head of the bed is where she wanted it to be before I left the room, especially if she was on bed rest. And I would make sure that her side rails were up and that the bed was in the lowest position. We didn't move it this whole time. And I'd make sure that it was locked. I would check by going like this. Would you like your collet in your right hand?
Yeah, that's fine.
Perfect. And anything else before I leave?
I don't think so.
Okay, well, thank you, Sarah, for your time, okay? I'm gonna just wash out before I leave. Thank you.